I'm Dani Gasparini, and welcome to this segment of Penn Voice. I'm joined today by Eric Raffin, who is the Chief Information Officer for San Mateo County Health System. Let's talk about your job first and what a Chief Information Officer does, because it may be a little bit different than what we might think that you do on a daily basis for the San Mateo Health System.
Sure. So as a Chief Information Officer, most of my time is spent actually strategically managing all of the health information that we're gathering and documenting and then sharing and utilizing to improve people's health. So that's done through a variety of ways. It might be through an electronic health record. It might be through our environmental health program. It could be in our behavioral health and recovery services area. But it is really about the strategic management of all of that healthcare information, and there is a lot of it to manage.
So you really are a technology geek.
I am the chief geek of our organization, yes.
With a health focus.
Yes.
Which is so fun.
Very much so.
So tell us how you ended up becoming the chief geek in health information systems.
It started after I finished graduate school. I started working at the Department of Veterans Affairs and was in an administrative fellowship program on the CEO path. And after about 2 years, it was time for me to actually take on my first, management job. And when I did, the opening for the Associate Chief Information Officer position was there, and I leapt into it and realized that I loved it. I didn't have formal technology training in my background. I was trained as a healthcare administrator.
So how many years ago was this?
That was in 1996.
Okay.
And so, 20 plus years now in both healthcare leadership and healthcare IT, and it has just gotten more interesting over time, mostly because healthcare information systems and technology was sort of behind the curve.
Right.
And so it has been blossoming really since about the turn of the century, and it continues to grow and expand and get more focused on the person, get focused on the client or the patient. It's really exciting.
So we probably should set the table in that in 96, the exchange of health information was from a folder that went from somebody's office through a courier over to somebody else's office, maybe through fax. Now the electronic medical records has revolutionized how we share and the time it takes for one report to get to another division, to get to another department for, and to the patient itself.
That's right. So it's so much better than it was, but we still have a long way to go.
And part of that is HIPAA, the Privacy Act, to make sure that these systems that we are using, these technology systems that we are using to share health records are completely safe, and that no one other than the people that are supposed to be seeing these health records are seeing these health records.
That's right.
So you're shopping for this software, so to speak, or you're looking for this health technology. San Mateo County is obviously adopting it. So that must be a large part of what you do in and of itself, just choosing the right.
That's right. It really starts with understanding what the business need is. All of the IT stuff really starts as a set of business needs and understanding what's most important and what do you have to get your job done, and then ultimately what are the nice things that you would like to have in addition to that that may make you a little bit more effective, a little bit more efficient, or provide a better experience for the healthcare provider. And
what does it mean to the consumer? What does it mean to the patient that is needing the information, or the information is about them?
Yeah, so the ultimate goal is to make sure that that information is available on demand at the point of service. And that's a struggle that really I think every healthcare organization in the United States continues to wrestle with to some degree, which is ensuring that when you show up, all of the historical or the longitudinal information that is known about you in all these electronic health record systems is actually available to that healthcare provider right when you're there.
So let's give an example of that. I go to a physician, and inevitably every year, or perhaps on some visits, I'm filling out a paper form that talks about the prescriptions that I'm on, have I had any surgeries in the last year, et cetera, et cetera, et cetera. So that's really the electronic medical records, or this health information system is so that we can reduce and not have to do those.
Right. Some of that is certainly a proxy for trying to understand what's happened in between visits. Has anything, did you end up in the emergency room? Did you stop taking a medication? Did a different provider provide you a different medication? Or were there lab tests performed? And the idea of moving towards an environment where that information is on demand and available right at the point of service is that the healthcare provider would be able to, look on a tablet, a computer screen, whatever format works, and actually be able to consume that perhaps even before you walk in or before the provider walks into your exam room.
So typically in 1996, the physician owned, if you will, your information. So this information then is in some central cloud, if you will, so that regardless where you were in the United States or beyond, or whatever physician or clinic that you did visit, this information resides somewhere that somebody can readily get a hold of it.
Right. So there are a lot of clouds in that analogy, and the difficult part is getting the clouds to some way be connected to one another so that there's no time lost, and there, like you had mentioned earlier, no faxes or no papers that have to be exchanged in order for you to be able to receive that information that maybe was acquired at a completely different physician's office or medical clinic or behavioral health, therapy setting.
So where is San Mateo County in the development of all of these readily available clouds for patient information?
So we have several internal clouds within the health system, and we're embarking upon this journey to implement a health information exchange to first and foremost unify all the information we already know about the clients that we're serving. But as a byproduct of that, at the same time, we will then be connecting with other healthcare organizations, not just immediately in San Mateo County, but around the Bay Area and ultimately across the state and the country, so that no matter where our clients may have received services, we'll ultimately have a much more complete picture of what happened.
So within the county, you obviously have, and you talked a little bit about in the beginning, you have behavioral health, we have the hospital, we have clinics,
That's right.
all of the different programs. So ideally then, someone within your system who is using any one of these services, this information would be readily available to the treating physician, and also the patient has the information back rather quickly.
So as we roll out this health information exchange capability, it will include all of the aspects that you spoke of about having the providers able to have that information on hand. Taking the next step, and the next step is the next logical one, is putting that information into really into the client's hands because it's their information.
Right.
That's on our roadmap. But first, we need to make sure that the providers actually have it in between our different divisions. And then if one of our clients is seen, say, at San Francisco General Hospital or at Stanford University, we also need to make sure that we can push, if you will, or make that information available to the providers in those organizations, especially in cases of an emergency.
Right.
Where they would greatly benefit from knowing diagnoses and medications and things. Especially if you were to arrive in their facility and weren't able to speak for yourself.
Right. So it sounds like that while we kind of teased our information officers as geeks, you are a critical part of the continuum of care and the proper care in an emergent basis, because the quicker information can travel, the quicker that patient can be treated and with the right diagnosis and the right treatment. Right.
So a lot of folks will say computers just make things go faster. Well, it's true. Computers do make things go faster. But in healthcare, there's a fair amount of complexity, and there's a lot of, as I tend to like to say, there's a lot of spaghetti in the background.
Right.
And disentangling ourselves from the spaghetti and putting in information systems like a health information exchange that allow us to actually provide a really simple view for healthcare providers about the experiences that their clients have had that they may not know about,
right.
That's not in the system that they're normally logged onto every single day, is a great add, and it is. It'll be instantaneous for them.
And so consumers or patients today within the San Mateo Health System, they're able to utilize parts of this health system information immediately.
There's some limited use of clients being able to have access to a client portal. to get that information. And as I mentioned in our roadmap, it would be to expand that and grow the capabilities so that clients will actually be able to access their own health information.
But the departments are all using the ability to share the information.
The departments will be coming online first to share with one another.
Yeah.
And then, yes, and then after that, once that environment is working, then it's much easier to provide access to our clients because then they get a full view.
Wonderful.
That's right.
Well, Eric, we are just out of time. What's the last kind of message you want to leave our viewers? And then we will have you back to ensure that we see all of this come to fruition.
That sounds great. You know, the message I'd like to leave you with is that there's a lot of concern about the security and confidentiality of health information. And what I would say is, in my 20+ years of experience, what I've watched is by bringing this information together in an electronic environment, we can actually remove a lot of the risks that faxing and paper and other sort of manual transit has created, all the risks that created. We're actually to really start minimizing that now, in addition to providing more immediate access to the information.
Well, Eric, thank you so much for this wonderful information. And it all goes back down to supporting the patient and ensuring that their health travel is a good one and a safe one.
Thank you very much.
Yeah, thank you all for joining me on Penn Voice, and we'll see you next time.